What is up, guys? Okay, so tomorrow I have an anatomy exam already, and it's going to be on the nervous system of the human body. So I'm going to be going over some of the things I'm going to be studying to get ready for my exam tomorrow. So, of course, I'm going to be studying a bit of my notes from class that I took. I took a bunch to prepare for this exam over the past few days. I'm going to be studying some of the quizzes that we took in class 2. So these are 2 of the quizzes. It's also a good idea to study your own quizzes. Yeah, I didn't do very good on this one. So study your quizzes, and a bit of a say, it's good to ask upperclassmen for help, so study guides are helpful too. And I'm also going to be going over some figures in the book. So there's the book, some of the reading I did. Going to be talking about some of the pictures, some important pictures to talk about. And if I run into anything I really don't understand, that's going to be going on these blank sheets of paper I have right here. So it's important that when you start studying, that your work desk is clear. So that's what I'm doing right now, making room, because it's about to get messy in here. Okay, so I first started my lectures for this exam tomorrow. First started on February 15th, so let's start from there. Okay, so the nervous system. The nervous system has connections to other systems in the body. Urinary and blood vessel connections are with the nervous system, the heart, digestive system, and muscle connections. So there's a negative feedback triangle that goes on here. So my professor wanted us to know the receptors, the controllers, and the effectors. Sensory or receptor apparatus, receptors, the 3 possible categories for receptors. So there's actually a figure I discussed in a previous video for you guys. This figure right here, it's in a very previous video of mine. So I talked about the different types of receptors right here, going up to the afferent division. So we're going from peripheral nervous system. Everything down here is peripheral nervous system. Everything up here is central nervous system. So we're going from the receptors to the afferent division to the higher order functions such as the brain and spinal cord of your central nervous system for information processing, to the more on the motor commands, or the efferent division to your back, and then back to the nervous system in the peripheral nervous system at the somatic. It can go through either the somatic or autonomic nervous system, and then it goes straight to effectors such as skeletal muscles, smooth muscles, cardiac muscles, and glands. So that was what we studied for the first quiz. I think I did pretty good on that first quiz. Let me check. Yeah, that looks pretty good. Just gonna staple this in right here, so I don't lose track of my quizzes. Okay. Always keep your quizzes together, especially if your professor makes them this small. February 20. Oh, that's the latest one. Okay, so my professor wants to know receptors, controllers, and the effectors. So some of the receptors that are important are special sensory receptors, which are for auditory, visual, gustatory, olfactory, and the 5th receptor in your inner ear for balance and equilibrium. Monitors smell, taste, vision, balance, and hearing, sweeping through your cranial nerves that take information to the right part of the brain. There's also somatic sensory receptors. Somatic, so locate all over your body, monitors the amount of stretch each of your skeletal muscles are doing at the moment. So I'm going to leave myself some notes right here. So I'm going to put on a blank sheet of paper, study the figure. So it's going to look something like this. Just a bit of a note to myself to study. So somatic sensory receptors monitors the amount of stretch of each of your skeletal muscles that are doing at the moment. The brain is aware of the position of every skeletal muscle in your body and every joint in your body at all times. Oh, dang. The skin surface has tactile pressure, temperature, and pain receptors. The brain is aware of the position of every skeletal muscle in your body and every joint in your body at all times. Visceral sensory receptors in your visceral smooth muscles located in the viscera are all those smooth muscles surrounding your organs, blood vessels, and glands. I guess there's a lot of stress right now. I'm gonna to cancel this video for now. I'm feeling a lot of stress. Hopefully I'm still ready for this exam. I'll let you guys know how it goes. Peace.